right, peace be to you. Assalamu alaikum. This is Omar Abdul Malik, physician assistant slash associate and health educator. So tonight, I just came home from work. I wanted to talk to you all about the death of Marke. For those of you who don't know, he was a rapper who was very popular back in the 90s. So he died July 16th. From cause of death was apparently complications from type 2 diabetes. He was 57. So again, another black man in my age group. I did a previous video on the death of DMX, and I think DMX was 60. And in that video, I said that at least in the United States, we're going to see a lot of, within the next few years, we're going to see a lot of relatively young black men dying. Those of us who are aging Generation Xers. So if you're born around the mid-1960s, you're going to see a lot of these guys that are in the entertainment industry, sports entertainment industry, dying. So they'll be in their late 40s to late 50s. And it's unfortunate, but I think that it speaks to a larger issue of health disparities. Got this mosquito bothering me. Health disparities in the United States. Now there was a one news outlet that chose to make the link between Biz Marke's death and racism. So the news reporter, who was actually a white guy, he said, "Well, this is proof that systemic racism is alive and well, and this is one of the causes of black men dying early." So I think the average white man in the U.S. anyway lives to be about 78.6, roughly. And the average black man, especially in the inner city, lives to be about 70. Now, I personally think that there are racial issues that certainly play a part in that. And I'd be very naive if I said otherwise, I think. I've been in the healthcare field for more than 30 years now. So I know what I've seen. I've published original research, so I've even researched this. Now, in terms of being able to quantify how much racism plays a part in us, black men in particular, having a markedly lower life expectancy, I think that's very difficult to quantify. We know it's shorter. That's a qualifier. But if you said, well, is it 10% racism? Is it 20% racism? I think it's almost impossible to quantify those types of things. You also have to look at the propensity of black on black crime. I'm a Washingtonian. There's a lot of wayward young brothers who were quote unquote were killing each other, and that also brings the life expectancy down. Quite a bit actually. But in terms of those of us who are aging Generation Xers who are dying from what I would say are preventable diseases, so hypertension, type 2 diabetes, hyperlipidemia, obesity, and that's not fat shaming, but I can tell you as somebody who treats patients who have BMIs, body mass index, well above 30, obesity does complicate issues. It's a confounding factor with folks who've got multiple morbidities. And we're seeing this a lot with this COVID-19 pandemic. What else? Other things, our inability, or I would say our to some degrees, less effective ways of dealing with mental health issues. So oftentimes substance abuse and I've treated a lot of my contemporaries who sought to use drugs as to mitigate a lot of the mental health issues that they've had, whether that's depression, bipolar, PTSD, and a lot of these things obviously have deleterious effects on the body. So there's I don't know what can really be done about this, if anything. As I always say before, try to do what you can about yourself. Try not to smoke. Try not to or smoke cigarettes. Try not to drink alcohol. I've treated a lot of folks, my contemporaries, with alcohol-induced liver disease, and they die, relatively quickly. If you're when you're having sex, try not to be sexually promiscuous. Try to use protection. I did HIV work for 15 years, and I saw a lot of brothers come in with poorly controlled sexually transmitted diseases, AIDS, syphilis. Syphilis can kill you. Try to control what you can. There's modifiable risk factors and non-modifiable risk factors. But it was sad to hear that Marke died at the age of 57. I wish I could get to some of these guys before they die to try to help them with lifestyle management. Getting your diet under control, exercise, stress reduction, those kind of things. But again, back to the racism issue, I'd like to maybe develop some type of tool to see if I could figure out, the degree to which racism played a part in our early demise. But I don't know if that's even possible. But, try to control what you can. I try to use myself as an example. I'm in my 50s now. I'd like to see my 70s. I gotta finish helping my wife raise our children, and there's some stuff I want to do on my bucket list, God willing, inshallah. But that's it for now. I'd like to know what your thoughts are. What's the real reason, quote unquote, the real reason that black men tend to die earlier than almost all other groups, or even have poorer health outcomes. In the past week, I've had a couple of patients die, black men, and I'll have patients. I'm a hospitalist physician assistant. I got a slew of black men in the hospital that have had strokes and are on dialysis, have had myocardial infarctions, and they're all around my age. The white men tend to be older, and especially the white women also. But that's it for now. I'd like to know what your thoughts are, what we can do to kind of curb this incident. What are you doing with your own life if you're in that age group? What are some of the lifestyle modifiers that you're doing, and what are some of the ways you're educating yourselves and educating your family and community? But I wish you guys the best of success in your positive endeavors. If you need any help trying to become a physician assistant / associate or health educator, I'll leave my contact information in the link in the description. Take care. Peace. Please remember, be polite in the comment section to me and to each other. Take care.